Talo falava malo lelei nisa pulavinaka ki orana whakalowalai atu noa ia ki ora whanau and welcome to another episode of the Pacific Health Talanoa show with Lorenzo Kaisara on BLU TV. Today is day 5 of the Mental Health Awareness Week in Aotearoa 2021 and this year's theme is Take Time to Kōrero, Mā te kōrero, ka ora. A little Talanoa, a little kōrero can go a long way. And joining me on the show today to share more about the integrated healthcare model that is being used and implemented within the mental health sector is Selwyn, Laura, and Laura. Kia ora whānau, welcome on the show.
Kia ora, talofa.
Hello, Falava.
Kia ora whānau. Thank you so much for taking the time out of your busy schedule to come on our Pacific Health Talanoa to share about your journeys and the amazing work that you do. Now, tell us, what is the integrated model?
Maybe I'll start. The integrated model is basically an extension of what you can access through your GP. So I work in the clinic. I'm a wellness advisor, and maybe we can go around and talk about our different roles. So when people come and see their GP and they're struggling to sleep, they've got headaches, they've got things going on that maybe need some input other than medication, then I often will see them and we'll talk about some things they could do to help with that. Or they might meet Selwyn or Tara.
Selwyn and Tara, would you like to add?
Yeah, so kia ora koutou, ko Tara tōku ingoa, ko Aotea te waka, ko whangaehu te awa, ko Mirimutu te maunga, ko Tirarangi te marae, ko Ngāti Tonga Iti te hapu, ko Ngāti Rangi te iwi. Nō reira, tēnā koutou, tēnā tātou katoa. So good everybody, my name's Tara. I'm the Awhi representative from Mahitahi Trust, which is a kaupapa Māori mental health service. Within Mahitahi, there are many secondary services, but just recently we've moved into this space alongside my colleagues here in primary care. And so my role is in Awhi is to pretty much is the link to the community as such. So everything that you discuss within the clinic with my colleagues, then Awhi comes along and we awhi our whānau in the community, navigate them to the right services that they may be needing, or even just walking along with them, whatever challenges that they're facing at the time. So an example of that may be, so for example, somebody may go into the clinic to see Selwyn in regards to their diabetes, and then I'll come along and awhi that whānau in the community. I will be able to support them to go to the supermarket, read the labels, to help them identify what kind of foods that may be better suited for them, possibly even, going through to their house, looking through their cupboards, just identifying what's better and what's not.
Yeah, so just tautoko both of my colleagues here. It's a amalgamation of several different roles, just adding to the clinical service that are already provided at your GP, and adding kind of a 360 view, holistic view to helping our whānau and family and friends in the community and getting them the support they need in regards to their health.
Well, awesome. So just listening to your kōrero, you may have different titles, but one thing that you have in common is supporting our whānau, supporting our community, supporting the people. Now, how you three have different roles, Selwyn as a health coach, Laura as a wellness advisor, and Tara from Mahitahi, community support worker, and part of the Awhi initiative. Now, can you share with us how you three work together to offer that support to our people?
Yeah, I guess it's kind of identifying the needs. We're aware that health doesn't just stop at the doctor's door. It doesn't just stop at the medication that they get. There's variance in the community, that social aspects that affect the person's health. One example I like to use, if a patient comes to me with need of understanding their diabetes, for example, I can talk to them about their medication, help explain that, or get a further advice from their GP. We can talk about understanding what diabetes is, and then we normally work into a little plan and what they can do for themselves. If there's something identified, such as several times patients come to me and said, I don't have the food at home to take my medication, so I'm not taking the medication. I'm like, okay, well, I can then talk to Tara and just say, hey, this person needs some additional support outside of the GP service, or maybe they identify that they're having stress at home, and then I can pass on to Laura or a wellness advisor to help with more, I don't like to say mental health, but to help with more life stresses and so forth. So yeah, and we talk between. Laura can do the same. She talks to Tara if she identifies, and if maybe Laura identifies someone with a health requirement or needs to talk about nutrition or exercise, and they'll hand over to us. So it's a real 360. We all communicate and create a circle around these people to help them.
And I guess another example might be someone with diabetes who's nervous about taking insulin. So that would be, so if there's kind of worry or fear around needle use, and that would be perfect kind of thing that I might be able to help with. Or, we know lots of people experiencing stress that can get in the way of taking medication. So it might be that the doctor identifies they benefit from a health coach or a wellness advisor. And also important, you might hear the term health improvement practitioner or HIP. It's exactly the same as a wellness advisor. Or it might be that the GP goes straight to someone like Tara from Awhi. So really just depends on what you need at the time when you come in to see the doctor.
Yeah, I guess, wellbeing has a whole range of different factors, may it be health issues, social issues, even cultural issues. So having a range of different people be able to support with that definitely plays a massive part.
Awesome. I just like how you have all, you have that link, all your jobs linked together, and to make sure that our whānau get the holistic support, from a wellness advisor to a health coach to a community support worker. I really love the, part of your job, Tara, is, the food label reading, because to be honest, as specific, even myself, I'm a victim of that. I go to Pack and Save or a supermarket, and all I do is, putting anything that I want, in my trolley without even reading the labels and double check what is in those products, because it has a massive impact on my health. But I love how, you can refer people onto other services out in the community. For example, there's Butterbean Motivation. There's a lot of fitness, exercise, organizations that can provide that free service. So I love that. So now talk to us, share with us how you work with individuals. For example, like myself, I come to you and I'm finding it hard to quit smoking. I'm finding it hard to manage my diabetes or to manage my gout. Talk to us how you work with individuals and whānau to encourage behavioral change.
Well, I guess our main focus is self-management, right? So our whānau are at the forefront of all of this. They're the ones that are creating these goals and how they want to achieve them. We're just there to kind of navigate them and to the right services and, do this with them. They some whānau often lose focus or lose motivation. So having somebody like myself that's able to go to their house and do these things with them, like go for a walk with them or go to the shops with them, whatever it may be. It just, someone's walking alongside them pretty much. And then, in turn, after a while, we'll So an example may be like, going to the pools, may not want to go swimming or anything like that, but having somebody walk in the pools with you. And then eventually, like, I will sit on the sideline and, they can do it themselves. And then after that, instead of me going in with them, maybe I'll just drop them off. And then the following week, hey, how about you try and get to the pools yourself this week?
Wow. Love it. Thanks, Tara.
Yeah, so as a health coach, we obviously deal a lot with those long-term conditions, and how we look at it is it's really about empowering the person, trying to get them to understand. Basically, we start with what do they understand, then we kind of help them understand a bit more of maybe their condition and any questions that they may have, and then we look at what can they do. And we make really small little steps and little plans that they can do, and they can empower them to take control of their health.
And I think from the wellness advisor or HIP, I see anyone. So anyone, any age, no wrong referral. So it is really, it's pretty brief conversation, but the goal is that we talk on the same day. So a lot of the time, if you come into the clinic, there'll be a wellness advisor there or a health coach there, and it means that you don't need to come back. And so that I think is a huge part of what's helpful, is just being there on the day, and finding out about the person and what they need to kind of make that next step. So really depends on what's going on for them, but very much echoing what Tara and Selwyn said, recognizing we all kind of know what we need and what's good for us, and we just need a bit of kind of support or guidance or a space to kind of reflect on what's not going so well to make those next steps.
Well, thank you so much, whānau. Ngā mihi, thank you so much for your kōrero. I like what you say, Selwyn, about, people coming in to see you as a health coach and have a kōrero and a talanoa with you. It is not about educating, and it is not about telling them what to do, but it's about giving them options. And then our whānau and our community can then select, from those options to see which one is best for them. So I like that. Also, Tara, with, I see you as a go-to person, for our community, for our whānau. If they want to, be referred to Housing New Zealand or Kaingaora, they can come to you because you have a lot of information that they need to know. So thank you so much for that kōrero whānau. Now share with us, what kinds of people and challenges can you support?
Almost anything. Hey, there's no real, there's no wrong introduction, especially to awhiora. Anything really, may it be somebody who's just finding it difficult to navigate their way through work and income. They don't understand all the paperwork. Anything really, to be honest.
Do you also support, our whānau with, say, family or school challenges? They might be facing some challenges and problems in the schools, and of course diabetes, gout, any long-term conditions, as well as employment. Do you support our whānau with, say, looking for employment and social networking, as well as providing education?
Yep, 100%. Employment, housing, school, social networks, community groups, health, it's limitless.
And I think one thing that I was thinking about as you're talking about that, Lorenzo, is right now where things are at, and with hoping that we'll go down alert levels, I can imagine for a lot of whānau thinking about kids going back to school would be something that is exciting on the one hand, but also maybe pretty big change for children. So that kind of thing, if your kids were really struggling with the idea of going back to school, resetting routines, that would absolutely be something that I could help with, and I could connect Tara or adults in the family with Selwyn. Yeah.
Selwyn, would you like to add?
Who can we see? Again, just kind of supporting Laura and Tara, anybody. There's no wrong referral. And you can self-refer to us as well. If you want to come straight into one of your clinics, you can come and see your health coach and wellness advisor. You don't have to go through your GP. So yeah. And if, say, for example, someone, it has been a couple of times, someone's come to me and they're like, oh, I heard you help with blah, blah, blah. And I'm like, actually, that's more of a wellness advisor. So then I can just refer on to the wellness advisor. Or I can say, oh, mate, you might do with some help from Awhi or some external support, and then we can refer on to them. So yeah, there's no wrong, and they generally get to the right person.
Awesome, Whānau. There you go, our beautiful viewers and listeners. If you go to see your GP and say you're waiting for an hour, don't forget that there is a health coach and wellness support, wellness advisor, as well as a community support advisor based in those clinics that you can have a talanoa and a kōrero about other things that you might be going through before you go see the nurse or the doctor. So that's awesome. Now, can you share with us, so how can our whānau, our people access, yourselves, such a wellness advisor, health coach, and a awhiora support worker?
So I would encourage, if there's something that you've heard during this conversation that's brought up for you or it does in the future, go to your GP and just reach out. I'd encourage you to see your GP and let them know what's going on. And if it's not suggested that you meet one of us, then ask if that's a service that they have. So, the one criteria for us is that you're registered with us. So just find out what services are at your GP and then go from there.
Yeah, I know too with awhiora, like anybody can make an introduction, whether it be anybody in the clinic, your receptionists, your nurses, your doctors, and my colleagues here today, as well as, awhiora is kind of an umbrella of a whole range of different NGOs that support our whānau. So, if you just go into the website, I think it's Auckland, and there's, pardon?
I think it's Auckland Collaborative.
Yeah, Auckland Collaborative, yeah. You'll be able to see a whole range of different NGOs that support in the awhiora space, and you can just even reach out to them directly.
Wonderful whānau. Now, it is aucklandcollaborative.co.nz, or you can get in touch with your local GP and get more information about the whole system and the process on how you can access. Remember, you have your right to access this free service for you and I. Now, Tara, Laura, and Selwyn, we all have our own reasons why, and our why. Why do we love about the work that we do? Can you share? I hope you don't mind sharing with us. Why do you love, the job that you're doing for our community?
Well, yeah, I think that's it. Community, yeah. For me, anyway, I'm Māori Samoan. So there was a period of life there where I was looking at my family and I just went, there's lots of sicknesses and challenges for us to get the right health and so forth. So I saw that, and I was actually a personal trainer before I was a health coach. And then I saw a disconnect between clients were coming to me to ask me about medication and stuff like that. And I'm like, there's a disconnect here between the patient and the clinic and the clinician, and we see it all the time. And that's why I love my role in particular as health coach, because I get to kind of bridge that gap. We're creating a connection, because you can sometimes walk in there and the doctor says something and they're like, oh, okay, that's what I have to do. And you don't understand it and you just walk away going, oh, okay, I'll just do what he says, even though I don't really understand. So we're trying to bridge that education gap and so forth. And yeah, it's for my family and to create an environment for my people in these communities. I have family in South Auckland and West Auckland, and yeah, trying to bridge that gap and make it better for them.
For me, I'm a health psychologist by background, and I've worked in Auckland since I graduated. And I think the thing that always strikes me and why I really wanted to do this job, and I love it, is because, when something goes wrong, when something isn't right with your health or how you're feeling, you go to your GP. And, we have wonderful GPs, but they only have 15 minutes. And time is so precious. And so being able to be there to help when people are asking for help, it's just so rewarding. And yeah, that's why I love it.
For me, the reasons why I love my role is that people that are dealing with stress or mental health, there's often a criteria for them to have to meet before they're able to get supports. Whereas this, Awhiora and my colleagues here, we're primary care, so you can, there's no criteria for it. We can support anybody, and especially before, they become too unwell. We're able to tackle whatever issue it is head on and give them the tools that they need before they're needing those secondary supports.
Wow, ngāhi nui whānau, thank you so much for your kōrero. Just listening to your Talanoa, you all have a massive role to play in reconnecting our whānau to their identity, and reconnecting our whānau to hauora and well-being, reconnecting our whānau to their cultures and to their families, extended families, and also connecting our whānau to other services that are available out there that they have no idea about. They're not aware of. There's a lot of services out there, but they just need someone, people like you, to support them in their journey. So thank you so much, whānau. Can you share? Final question is, if you can share with us some tips to, with our listeners and viewers on how they can take care of their hauora and well-being.
Yeah, so my first tip would be just to reach out. That's probably the most massive one. And then, just be kind to yourself as well. Yeah.
What about whakamā, Tara?
Yeah, 100%. Like some of our whānau are very whakamā. They don't want to reach out for help. But the more we get this out there, the more it becomes a norm to be able to go and see your clinic and have somebody, walk alongside you in the community. That's fine.
Yeah, I'd say get active. Again, I come from a personal trainer background in sports. Just get active, go for a walk. And it doesn't have to be big. Sometimes, like I was talking about action plans and small little steps, literally. Sometimes the action plan is just getting up and walking to the mailbox and back a couple of times, and then maybe the next week you walk to the end of the road and back, you don't have to do much, but do a little bit,
Small steps, baby steps.
Yeah, literally, just get off the couch. It won't hurt. You'll be fine. We can do it right now. As soon as you stop listening to us, 5 minutes down the road, 5 minutes back, you're all good. And then you've been outside, you've got some fresh air. There's a whole lot of other things that come with that as well. So, yeah.
And I think the big one for me is talking to people on the phone during lockdown. The kind of theme that I hear a lot and that I can resonate with as well is so much uncertainty and how with more time and less kind of going on, people can find that they're thinking a lot more or overthinking, and that can really bother us. So I guess just that's really normal. And that I guess my kind of tip would be just keeping your expectations quite low, that looking after ourselves right now with everything that's going on can be about just those really, really basic routines of making sure we still get to bed at a decent time, still eat 3 meals, still go for a walk. And it's actually really, really good for our mind and our body to just keep those routines and know the overthinking, the worrying, feeling more nervous, really normal.
Great kōrero whānau, thank you so much. Tara Howell from Mahitahi Trust, Selwyn from Tamaki Health, Laura Thompson from One Support Team, Tamaki Health as well. Thank you so much for your time on the Pacific Health Talanoa. Day 5 of the Mental Health Awareness Week. Community, whānau, I just want to encourage you all. We also have a massive part to play to make sure that we get the support and to make sure that we are healthy. We need to meet halfway with the health professionals, with health coaches, community support workers, wellness advisors, our doctors and nurses. We all need to work together as a team. I just want to acknowledge all our guests that came on Pacific Health Talanoa this week for the Mental Health Awareness Week campaign. I would also like to acknowledge BLU TV, local doctors, Tamaki Health, Mahitahi Trust, and Mental Health Foundation. Thank you so, so much. Don't forget, remember to take time to kōrero, tā kōrero, ka haora. Take time to talanoa and don't be whakamaha. Please ask for help. Ask for support. Happy Mental Health Awareness Week, Aotearoa. I'll see you on Monday.
Squad, baby. Rex, J. Sands.
Let's go.
Oh, say I'm say you are complete to me, I get you. By the way that you move and the way that you smile. Say, oh my dorima, baby, you be giving your hand, I'll take you anywhere. You give me something that I never had. Cause you care, but about to me and the family. Say, why you waiting on me to talk to you? Yeah, I'ma listen what y'all say. Yeah, don't move out in the come here. Yeah, they on the layout, oh, dirty wine, girl, dirty wine, yeah. Say, Tamaki, they look the bite, say, boom, baba.